We know the moment is right for healthcare reform. We know this is a historic opportunity we've never seen before and may not see again.
On Capitol Hill, one issue is going to dominate the legislative agenda for the rest of the year. It's healthcare.
I'm going to sign this into law.
Few thought that the Obama administration would be this well positioned to achieve a healthcare victory in the months ahead. There are already bills being considered, and President Obama has signaled a willingness to compromise and not micromanage the details, an approach that's designed to avoid the mistakes of the past.
It is an American problem that we are going to solve before the Congress goes home next year.
As history shows, the effort is now entering its riskiest phase. For instance, in mid-1993, the Clintons' proposal seemed unstoppable. The Democratic effort will likely hinge on three very specific questions. First, will there be a so-called public option to compete with private health insurance companies? Second, will there be a new mandate on employers to buy insurance for their workers? Finally, how's the government going to pay for it? One of the most controversial aspects is the idea of creating a new government-run entity to compete with private insurance companies.
The public option is not your enemy, it is your friend, I believe.
But it's quite controversial among conservative Republicans.
The government will never compete fairly.
They will absolutely use that model to get to destroy all the insurance companies and get to a national health system.
The idea is still very much in the abstract, though. Administration officials won't lay out in detail what a public option would actually look like.
We think there should be a public plan, but a public plan is on a continuum. What is the public plan? Is the public plan just Medicare? Is that the public plan, that you add everybody on to Medicare who is going to need help? Or is a public plan something further down the continuum?
Among more moderate thinkers, there are multiple ideas about how to push it down the continuum. Len Nichols is a healthcare expert at the New America Foundation.
And let some kind of local board or committee decide if they want to unleash the public plan. I could imagine that kind of fallback thing.
There's even some ideas that conservative Republicans are open to, such as member-owned insurance cooperatives instead of a public plan.
And where we live in the Midwest, the idea of co-ops is not an unusual idea. And I'd like to see what they're thinking about there. It depends on how independent those co-ops are truly allowed to be.
The challenge will be finding a middle ground that will satisfy Democrats as well as moderate Republicans who could be crucial to final passage.
There's a lot more realization this should not be the issue on which health reform succeeds or fails.
The second main question is whether employers will be required to insure their workers. President Obama is receptive to the idea.
While I believe every business has a responsibility to provide health insurance for its workers, small businesses that can't afford it should receive an exemption.
That idea was a major part of the 1993 plan.
Employer mandate has a long history, and unfortunately the history is almost all bad. For me, it's a no-brainer. Don't have an employer mandate.
Joseph Antos at the American Enterprise Institute has a more conservative outlook.
The employer mandate tends, however it's arranged, tends to reinforce the system that we already have that doesn't work very well.
If some form of the mandate idea ends up in the final bill, a big reason may be that it would bring money into the system. The question of how to pay for it all is the biggest one out there.
Making health care affordable for all Americans will cost somewhere on the order of $1 trillion over the next 10 years. That's real money, even in Washington.
The challenge is about finding a balance between increasing taxes and finding greater efficiencies in the system. Not surprisingly, the Democrats are focused on the efficiencies. Nobody likes to talk about raising taxes, but few think that will be enough.
Paying for it is an important thing, and I know that you're going to hear that from our side numerous times.
How are we going to pay for it? Is there a proposal yet besides eliminating fraud, abuse, and waste? Well, it's unacceptable.
Making the system work better is crucial for the long-term viability of healthcare, but nobody really knows how much money can be saved in the next 10 years. President Obama has said it will pay for a large percentage of his plan, but conservatives think it will be much smaller.
There's nothing about this year that should make anyone think that those ideas are ready to come to full fruition anytime soon, and they won't.
But some, who are closer to the Democrats, believe it is possible.
We can do it. I believe the debate is going to come down to essentially, do we believe we can do it? And I think that's what Congress is going to be talking about.
There are months of compelling negotiations ahead, from the likely return of one of the legends of the Senate to an already aggressive media campaign by outside groups. The central debate will hinge around these three questions.
I wouldn't call whatever comes out watered down. I would call it realistic.